Now let's return to Myanmar, because rebels fighting in the country's civil war have declared a ceasefire in an effort to support the humanitarian response to Friday's devastating earthquake. The death toll has now risen to 2,700, though the military junta has downplayed figures in previous disasters. I'm joined now by Chris Skopec, the Executive Vice President of Project Hope, a global health and humanitarian organisation which has teams on the ground in Myanmar. And thank you for joining us again, Chris. Hopefully audio is better this time. I'd just like to ask you about some of the biggest challenges in administering aid and what your team there is finding.
Well, I think first and foremost is just the criticality of time and getting assistance to the people that need it when they need it. We're facing massive infrastructure damage, bridges out, roads out, communication networks down, but it's also over 40 degrees Celsius right now. The temperatures are tremendous. Most people are unsheltered because their homes were destroyed or they're unsafe to live in at this time. And so we need to get assistance to them as quickly as we can.
And of course, with all this, you're navigating damage when it comes to infrastructure, limited access to affected areas, no doubt, as well as, no doubt, communication challenges. How is the team able to navigate this?
Just as best as they can. We're working with fantastic partner organizations on the ground that have been there from the very first day, distributing water, distributing food. But again, there's a huge number of health concerns that we're facing, and not just the trauma wounds that obviously the crush wounds that the hospitals and the clinics are facing right now, but secondary infections if those wounds are not taken care of, concern about outbreak of diseases, waterborne diseases with water systems compromised, vector-borne disease, communicable diseases with people living unsheltered and in crowded spaces. So really trying to limit the damage that has been done, mitigate the number of people and casualties that have been realized already and are going to be in the coming days and weeks.
On those public health concerns that you mentioned, can you talk me through how this is better, worse, different to previous disasters that you've worked in?
Well, we can compare it with two massive earthquakes that took place 2 years ago. One was in Turkey and another was in Morocco, both in 2023. Neither of them took place during the hot summer months. And so, again, not to sound macabre, but the concern about exposed bodies and those that have not been excavated and not been properly buried are creating additional public health hazards. And 40-degree heat, humid weather is posing a real public health concern.
Hugely tough conditions in which to operate. What more needs to be done? What are you asking for from the international community? How can people help?
Well, we really need the international community to step up. The government of Myanmar has requested international assistance, and that's what's needed right now. All the donor countries need to step up and recognize that this is an all-hands-on-deck emergency. The scale of this disaster is immense. The numbers we're seeing today are only going to grow, and speed is of the essence. So it's time to come together as a community and provide the support that's needed for the people of Myanmar when they need it, which is right now.
Chris Skopec, thank you for coming on the program and giving us the latest.